we have here with us the Minds Foundation, the White Swan Foundation for Mental Health Talks India, as well as so many of our Melton Fellows from around the globe. Bridging the Gap in Mental Health Care was a town hall that we've had in mind for many months now. And with September being Suicide Prevention Awareness Month, as well as World Mental Health Day just around the corner, we thought, there's really no better time than to come together to discuss such an important cause. At the Melton Foundation, we are in 6 major world regions, including China, Chile, Germany, Ghana, India, and the United States. And more recently, we've been on an endeavor to set up global citizenship hubs in our local regions. And in an attempt to bring one such global citizenship hub to Bangalore, we reached out to some of the fabulous organizations that you can see on the screen, as well as who are with us in the panel today, to maybe come together and organize a digital event, given COVID-19 that we can't meet in person. Having said that, I think COVID-19 has also taught us a lot about mental health and well-being and why it's even more important in times of crisis. So without further ado, I think we should definitely get started. I'm so thrilled to welcome everybody here, and I'm now going to hand over to our fantastic moderator and host, who's a Melton Fellow. Aside from being a Melton Fellow, she's an extremely accomplished performance psychologist. She has so many certifications and accolades to her name. I'll let her tell you a little bit about herself and then take us through the evening. So over to you, Dr. Vernice Richards.
As Ashley said, my name is Dr. Vernice Richards, and I am a senior fellow from the Dillard University campus in New Orleans. And then I'm also a PhD at Florida State University Performance Psychology with a bunch of other human performance disciplines. So that goes into cognitive behavioral therapy, clinical mental health, yoga therapy, and quite a few others. So I'm very passionate about mental health. So participating in this town hall with mental fellows, and then also noting that my Google Docs just reminded me that exactly 1 year ago today, we were in India doing presentations on mental health and mental health access and performance psychology. So super thrilled to be able to have this 365-day rotation on this process. So today we are looking at the gap in mental health and well-being in India, and we of course have some information about some other parts of the world as well. We have a ton of really exciting panelists, partners, contributors, and fellows that are a part of the Zoom chat. So before we get too into it and too excited, just a couple housekeeping things. Now, as we get through this process, we're going to have a ton of questions. We know, especially during this time, a lot of information, and we're quite overwhelmed with what to do, what not to do with respect to mental health. So I understand your excitement and your interest in getting a lot of this information in. Through all this process, though, I'd like you to try to keep your mic on mute. We'll try to organize that in the chat pod. If you have questions, comments, concerns, either for a particular panelist or just something that's on your mind, please put it in your chat pod so that way we can get to them. When you registered, you did put a couple questions in there, so we fielded through some of those, and we will try to address some of those as well. So the only thing really is to just be open and be committed to curiosity. So we're going to work through this process, and before we get any more started, let's try to settle in and get ourselves ready to be open-minded for this process. So I put together a 2-minute exercise for us to try to get our brain warmed up a little bit and our hearts a little bit open. So if you can settle into your chairs, I believe we have everybody in, and the panelists, if you could participate, that would be awesome. And if you have any questions, comments, or concerns about this exercise, please put it in the chat pod, and then once we're done, we'll just roll right into our panelists, our questions, and our topics for today. Okay, so we are going to get started with our process, and with our intentions in mind. Continuing that deep breath, we have an opening address from Dr. Stefan Beckman, our esteemed Executive Director of the Melton Foundation and Senior Fellow. So we are very excited to have him join us and to share some information about our topic today and Melton Foundation.
Thank you so much, Vernice, for this wonderful, beautiful exercise to get us started, and welcome everybody on this call. It's really an honor for me to be with you today. I'm actually working from Chile, so it's 10 o'clock in the morning here on a Saturday, which is a good start to think about well-being, relaxing, and getting into the mood to think how we all can help people around the world and, of course, ourselves for feeling better, to increasing our health and our inner peace. Like Vernice said, I'm the executive director of the Melton Foundation. For the ones that didn't know this organization, let me just briefly tell you a little bit about us. We were founded actually in 1991 by a US entrepreneur with the name Bill Melton and his wife Patricia Smith. And since almost 30 years now, we are engaged in empowering young change agents around the world. So in our core, we run a program where we support young students to have access to globalization, to get another mindset about local problems and their global attitudes or their global kind of influence of local opportunities, challenges, and what we can do in small steps also in our local communities to really fight for a more sustainable, healthy world where we can live in peace and are responsible also with our natural resources. So each year we select students from 6 cities around the world that our wonderful moderator or senior fellow, also Ashita Nayak, organization of this event mentioned. And it's interesting because we're really spread out over the globe. So as I said, I'm working from Chile. We also are connected to the city here in Temuco in Chile, where at the moment we also run in parallel a workshop, an innovation marathon about clean air. Then we are present in the United States in Dillard University, which is New Orleans historical Black universities. Then in Jena in Germany, in Agra in Ghana, in Hangzhou in China, and in Bangalore in India. And just like Ashi said, this event is also part of our effort to kind of increase our local impact. Because even though we are this global spun worldwide, or not worldwide, but a very spun kind of network, historically we were more engaged in communicating among ourselves, but we realized it's really the potential that we have to work with local organizations that we are striving to be much more impactful. Many of our activities are also very strictly or very in line with the United Nations Sustainable Development Goals, because we believe that this set of goals really gives a good framework about how we as individuals or organization can orient our efforts to some well-defined goals to make this world a little bit better. And there, the SDG 3 talks about health and well-being, which is really a topic of concern for us since many years. Even before the pandemic, we already have run some workshops, and just like Vernice said, 1 year ago, we met physically in India and did workshops with students there about well-being. But of course, now the world has changed drastically due to the pandemic. There's a lot of new challenges that came for mental health. I can tell you also in my personal sphere of relatives, there's also some struggling with all these topics. So it's something I think that each of us lives and has really a close connection to. So I'm really thankful for all these organizations, speakers, panelists, viewers today together to talk about mental health, to give also the voice to the people maybe that struggle, to let us understand how we can do better for us, but also for others. And I really enjoy being here with you today. I want to thank once again all of the partners as well that are here doing this open call with us, and just want you to enjoy this. Breathe deeply, as Vernice said, and I wish you a wonderful, beautiful day and this event. Thank you.
Hey, thank you, Stefan, for that wonderful welcome. We're really happy to have the Melton Foundation put on this town hall and to engage the partners in India. So to start us off, we have Mr. Manoj Chandran, the founding CEO of the White Swan Foundation. The White Swan Foundation is a Bangalore-based non-profit organization that offers knowledge-led solutions in the area of mental health. They provide persons with mental illness, caregivers, and communities with well-researched information that helps make informed decisions on how to deal with mental health issues. Their mission to deliver knowledge, services for mental health and well-being resonates with us as a foundation and for this town hall deeply. And we are thrilled to be partnering with them in our small endeavors towards promoting the SDG 3 of the UN Sustainable Development Goals, good health and well-being. The founding CEO took 25 years of experience in this field, so we will have a ton of questions for him. Reminder for everybody that's watching, use the chat pod to ask any questions that you might have. Unfortunately, we won't be able to answer questions during the addresses, but if you put it in the chat pod, we'll really try to get to it. Dr. Manoj or Mr. Manoj?
Thank you, Dr. Venice, good morning, good afternoon, good evening to everyone. And Melton Foundation, thank you. A very special thank you for choosing mental health as a subject for a town hall. This is such an important, such an urgent topic to be discussed. And before I explain about what White Swan is, I really want to spend a couple of minutes to tell you about why youth really matters in bringing in change in the mental health care space the world over. You know, so we've been in this field for about nearly 7 years, and one of the there are many challenges mental health care you would find has across the world. You will hear about the lack of enough mental health professionals. There aren't, in particularly low and medium middle income countries, there aren't enough hospitals, and so the service infrastructure is really lacking to be able to serve the huge number of or huge prevalence of mental health issues in our society. And there are many such challenges and data points that will tell you about the gap areas. But when we did our research, we found that the most fundamental gap area that exists in mental health care, and that must be addressed, is in our inability to make right decisions. When I say our, it is all of us, and not just the person with the mental health issue or their caregivers. And the second most important thing that we learned was that the most powerful person in mental health care is the bystander, is me and I and you. We are the people who may probably be bystanders, who may be colleagues, co-workers, friends, relatives in the family. And we may not have a problem, we may not be caregivers, but because we have a view, a certain notion, certain attitude towards mental health care in general and towards those with mental health issue, we automatically become stakeholders. But because we don't have the capability to be able to make the right decisions, we are not really contributing in a positive manner in most cases. Which is why, if you notice, the two most important data that we must absorb in mental health care is that, at least in India, and this is, I'm told, true for many countries in the world, 90% of those with mental health issue will never ever receive professional help. 90%. Can you accept that? Imagine if 90% of people with just mere fever or malaria kind of problem would never ever go to a doctor. It would be catastrophic. But we somehow accept the fact that it is okay if people with 90% of the people with mental health issue won't go to a doctor or a mental health professional. We must not accept it. Second, of those 10% or 15% who may eventually reach out to a mental health professional, large number of them do so after a prolonged delay. So it takes sometimes years for a person to decide, after going through a mental health issue, to say that I think I'm now ready to be in front of a mental health professional. We can't accept it. Now, how do we change this? It's only possible when we build decision-making capability, because the moment we see most of us, encountering mental health issue, the first thing that happens to us, the first question that comes to us is what to do. I don't know, it's confusion. Or then sometimes it is about fear. It is about not wanting others to know about it. It is these kind of viewpoint, it is this kind of confusion which creates the delay. It creates that incapability in making the right decisions. So it is, and how do we therefore bring in the change? Now, if you look at the two aspects, which is about incapability of making the right decision and that we are all a stakeholder of mental health care, we have to really, the fundamental kind of solution to mental health care the world over is about bringing in transformative change here in the society, in the social challenges that people go through in addressing their problem, and which requires every single stakeholder to work on it. So here, I see a huge hope among the youth. It is the youth that we really rely on to be able to bring in that transformation, to be able to bring in that social movement so that the society begins to break the chain and relook at the way we have always looked at mental health care and those with mental health issues. We have to make sure that stigma is completely uprooted. We can't accept any more stigma or any more exclusion of those with mental health issues in our spheres of life, in our society. That is possible only when the youth rises. And I've really seen in my experiences, in my interaction with the youth, at least in India, they really are the torchbearers. The way they have really risen in the last few years to say that I am going to disregard the age-old kind of notions that we've carried around mental health care and reach out for my mental health issues to mental health professionals. I wouldn't mind if others come to know of my mental health problem. I would be very inclusive of my classmates and my co-workers who have mental health issues and all. So this is so promising, I would say. So therefore, the social transformation that we can really bring, and we must bring to change or address the most fundamental problem of mental health care, it is the youth that we can really look up to. And this, I think Melton Foundation as one of the organizations can really be an agent of that transformation. So we really, I'm very happy about the fact that Melton Foundation and the fellows at Melton Foundation today are discussing about mental health care and their role in bringing the transformation on mental health care. It's only when this happens can we begin to say that other challenges about providing access to healthcare, better quality healthcare or affordable healthcare, or creating demand for healthcare. In fact, that does not exist today in India and many countries like India. We need to really create that demand for healthcare. That will happen only after the most fundamental issue of social change begins to happen. So with that kind of intent in mind, nearly 7 years ago, White Swan Foundation was created in India with a very unique proposition. We said that if we are going to place the right information or access to right information and knowledge in the hands of every human being in the country on mental health care, chances are that they will begin to, or they will be empowered to make the right decisions on mental health care. And in the process, over the last 6.5 to 7 years, we have created India's largest knowledge repository on mental health care, which is available on the online portal, on the online medium, but has also now grown in many ways to be able to do community outreach programs across a whole lot of communities and mass communication program to include the most powerful stakeholder, which is the bystander. So we really take extra effort to make sure that that one person who carries a not so positive attitude and viewpoint on mental health care, can we engage them in our scheme of things, in our discussions and conversations, and bring about a mindset shift. And we would love to see how we will be able to work with different communities and different organizations and change agents like Melton Foundation to bring in that social transformation. So with that, I would really close my remarks and look forward to more interactions with the people here. Thank you so much.
was a nice little video to pick us up a little bit of energy. And we're going to introduce Adishi and Ayushi of Mental Health Talks India to address us now. Adishi Gupta is a gender studies graduate from Delhi. She works as a content editor at MAD in the Asia Pacific and created Letters of Kindness in 2019. She has been co-curating Mental Health Talks India since May 2018. She is passionate about issues related to gender, mental health, and our rather complex emotional lives. And joining her, we have Ayushi Kemka, who created mental health initiative called Mental Health Talks India in 2018. In April, she believes that channeling one's vulnerabilities into an honest conversation can potentially bring about change in how we live and exist in the world. She's also a PhD scholar, so soon to be doctor, at Jawaharlal Nehru University, working on the intersections of gender violence in social media. So Ayushi and Adishi, over to you.
Right. So hi everyone, thanks a lot for watching the video. I'm glad the sound worked out, yay. And I hope you liked it. And so let me just quickly take this moment to thank the Melton Foundation for organizing such an event, because we truly do need to work on mental health on a global level. And I'm really, really happy to see a varied set of people over here, like albeit virtually, but that's how it is going to happen for a long time now, I guess. Now, to just give you a brief idea about Mental Health Talks India and how we are working towards bridging the care gap in mental health field, let me just tell you a quick short story about how I came into being. So I am Ayushi Kemka, and when I came out with my own mental illnesses to my peers in my very fancy-ish Indian university, I was met with a lot of stigma despite the immense privilege and access to information around mental health available to the people around me. And there was one particular incident of mental harassment that I faced at my university, which had me in equal parts tears and rage at the same time. And that triggered the creation of Mental Health Talks India in its present form that you see. And I was extremely just happy and elated to have Adishi join me just like a month later. And there's been no looking back ever since. So as people who have been battling their own mental health issues, and our major goal at HCN is to establish experience as a valid category. So people, especially in India, are still quite reluctant to see user survivors or service user, whichever term you may want to use, as experts in their own fields. And this is what we wish to change. We cannot talk about bridging the care gap in the mental health space by only narrowing it down to accessibility of drugs and medication. And while that has its own importance, we do need to broaden our own understanding of mental health care and the existing gaps. Bringing in people who have a lived experience of mental health issues can be the solution for our nuanced problems in the mental health field. That is what we truly, genuinely believe. Of course, we cannot and do not want to serve as replacements for, say, therapists or psychiatrists. Certainly not. And that's not what we can do and what we do not even wish to do. What we do, though, want is for the mental health care field to recognize us, that is people with lived experience of mental health issues, as major stakeholders whose expertise can be utilized not only to create awareness and advocacy, but also translate it into policy measures. I mean, so we just like saying this, that nothing about us without us. And while the whole world is sort of agreeing upon passing the mic, I see no reason why we should not be doing that in the case of mental health care. On that note, over to my co-founder at Mental Health Talks, Adishi.
Thank you so much, Ayushi. So you know how there are some things that you tell yourself you really want to do because of how important they are for you, but you don't know how or when you will do them. MHTI was that something for both me and Ayushi, and we would often talk about it every time, putting it in our to-do lists as something that we'll do sometime in the future. Well, we all know that these things actually happen when we do them. So be it in a moment of excitement or nervousness. In April 2018, Ayushi knew that it was time to stop talking about it and just go ahead and do it. I was amazed to see it come to life. And a month later, I found myself working alongside her on what we now know as Mental Health Talks India. Hi, everyone. I am Adishi. As someone who has been living with mental health issues for as long as I can remember, I would like to share that every time I have been discouraged to talk about something that has brought distress to me, something that is usually considered to be sacrosanct in the society, I have been reminded of the big gap in my own mental health care and in those of others like me. Every time I have tried to say that the reason or the source of my distress is something or someone who was supposed to help and nurture me, I have been shut down. It is with this awareness that through our work at MHTI, we constantly make sure not to shy away from difficult conversations, not to shy away from talking about how the larger structures of our families, our education systems, our governments have been failing us and how that directly affects our well-being. Our work at MHTI, both online and offline, has been guided by and focused on people's stories and experiences of living with mental health issues. And most importantly, centered around asking the difficult questions. So today, I would encourage all of us to think of all the conversations that we shut down as listeners because they were difficult, because they threatened to challenge our worldview in some ways. Today, we need to be readier to have difficult, uncomfortable conversations. Lastly, I would like to leave us with some of these uncomfortable questions. When we talk about bridging the gap in mental health care, are we asking what care looks like to people who are struggling? Are we asking what all inhibits care from reaching them? And finally, are we listening to what they have to say? Thank you.
Wow, this is some really, really good questions, especially looking at how is mental health perceived and then how it is addressed. So it really does stretch the gambit. So very amazing initiative. And so everybody who has questions, please put them in the chat pod. And also we have these impulse videos and partners that we're working with this town hall, the links to their Facebook page, their website, and some other, if you want to link to these videos as well, will be in the chat pod. So feel free to save those so you can look at it later, and you can contact any of these foundations if you have any other questions, comments, queries, confusions that we can move forward with. So we're going to go into our second impulse video for the Minds Foundation, and I will introduce our speaker right after this video.
જમીન નથી મારે કશું જ નથી બે બાપ દીકરો છે અમે એને પહેલી જ્યારે બીમારી થઈ ને તો એવો એ ઘૂમ્યા જ કરે બધા ચાલ્યા જ કરે અને રાત્રે પણ છતી ઊંઘ ના પછી હું બહુ કહેવતા ગુંદાએ માર લે મને પણ આપણને ખબર નહીં કે આવી માનસિક બીમારી આવી છે એ આપણને કોઈ ખબર નહીં મારી છોકરી કહે કે બીજો એક ભૂવો છે તે ભાતીએ ભૂવાને બોલાવીએ કંઈ બે દાડા ત્રણ દાડા સારું રહે પાછું ઘૂમે 70 ભૂવા કર્યા 70 ભૂવામાંથી 70,000 રૂપિયા ખર્ચો થયો મારો તો એ કલાસ ના લાગ્યો આ ફરક કે આ ભૂત પલિત નથી આ તો બીમારી જ છે આ મગજની બીમારી જ છે આ ખાય છે હુવે છે સારી વાત કરે છે એટલે સારું તો લાગ્યું છે.
Mental health is often misunderstood, stigmatized, and overlooked. Even when its importance is recognized, mental health care can be expensive, geographically distant, and culturally unacceptable, and therefore very difficult to access for many people. In India, there is just one psychiatrist for every 300,000 Indians. Globally, the need is growing, with a suicide reported every 40 seconds. We at Minds are working towards creating a world where anyone, anywhere can access the mental health resources they deserve. We are committed to eliminating the stigma surrounding mental illness through education, training, and providing access to cost-effective and high-quality mental health care. At the heart of our mission is education. We run mental health education programs in schools, workplaces, and communities, equipping people with the tools to understand, recognize, and respond to mental illness. We know that we can't do this alone, and therefore we partner with other organizations globally to ensure we can make the largest impact. Another key part of our work is providing access to mental health care in parts of India where this is severely lacking. Our team delivers cost-effective, high-quality care to patients suffering with conditions from epilepsy to schizophrenia to depression. We also believe in the power of community and therefore train local healthcare workers and teachers in mental health, building capacities to create sustainable societal change. We believe in evidence-based practices and therefore are committed to conducting research and publishing our findings. Since our inception, we have published 22 studies in internationally recognized journals with the help of 175 global volunteers and interns who have participated in our work over the years. A person's location or economic status should never be a barrier to accessing important mental health resources, which is why we work hard to share our programming online. We regularly host webinars with experts, publish manuals for mental health care, create educational videos, hold online training sessions, share tips on our social media, publish articles on our blog page, and operate a 24/7 helpline and email. We're in the process of expanding our operations in the United States, having hosted a number of events in the larger cities with great success. Specifically, we are working on developing our ambassador program and working with leaders in the entertainment industry to shed light on mental health and the real stories of those affected by mental illness across the globe.
Hi, I'm Dr. Raghu Appasani, the founder and CEO of the Minds Foundation, an organization dedicated to creating a world in which anyone, anywhere, regardless of where they are on the mental health spectrum, can have access to the resources that they deserve. I envision a society full of empathy, compassion, and love, in which anyone can be supported. Join us by following us on social media, by contributing and donating through our website, www.mindsfoundation.org, and by sharing with your loved ones. Thank you.
Okay, so we just met Dr. Raghu, but I'm going to give him a quick introduction as well. Dr. Raghu is a psychiatrist, neuroscientist, mental health advocate, and social entrepreneur focused on bridging the gap between Western and Eastern practices to create a wholesome society. He was born and raised in the Boston, Massachusetts area for the majority of his life, but as a 1-year-old, he lived in rural India for 2 years. He is the founder and CEO of the Minds Foundation, for which he has been recognized as a World Economic Forum Global Shaper, one young World Delegate Ambassador, Starting Block Fellow, Nexus Global Delegate, Echoing Green, Mass Challenge, and a list of other accolades. Right? He continues to pursue a career that bridges the Western and Eastern practices of healthcare in order to bring practices to those in every corner of the world, including the most vulnerable populations. He is also a research psychiatrist at the USC Brain and Creativity Institute, where he has been awarded the Della Martin Research Foundation grant to study the science of mindfulness-based therapies for mental illness. So welcome, Dr. Appasani, and let's hear some more about the Minds Foundation.
Thanks, Bernice. I should hire you to do my introductions. Thank you, and thanks to Melton Foundation, Mental Health Talks India, and White Swan for including us in this conversation. I think the video states a lot of the work that the team at the Minds Foundation is doing, but for me, I agree with Manoj and Mental Health Talks that at the core of the issue is, we can focus on building capacity through training and professionals, but at the core of the stigma, at the core of what keeps us back, and the biggest obstacle in making progress in mental health is a lack of literacy around the topic. And so it's really up to us to educate everybody. And, Manoj mentioned earlier as well that mental health affects all of us, including bystanders at the core. And it gets me to think a lot about the definition of individual versus human. And it's something that I thought a lot about during the COVID-19 pandemic. And I think it was one of the silver linings that really got me to think about the difference between this. And I want to highlight this because, I'm right now in Los Angeles in California, and the Western society has groomed us to be individuals. And this is happening in India as well, in urbanization and modernization, where people are becoming individuals. And what I mean by individuals is we're groomed to focus on how we can advance our own careers, and how we can take in a way to advance our own careers and then give back. But if we think about ourselves as a human, then we think about ourselves as the collective and the global collective. And everything that we do then affects all of us. And so to target and to tackle the issues of mental health, we have to start to think about ourselves as a collective, and that what we do and what we say and the language that we use to describe mental health can affect everybody. And so the work that we're doing at Minds Foundation is really to empower people with that knowledge, with that mental health literacy in schools, in villages, in communities. And we do it through not only direct workshops, but also through the power of storytelling and allowing those who have dealt with mental health to share their stories for not only the catharsis that comes from that, but to allow others who often feel so left in the dark without even their shadows there, where they feel that suicide is the only way out. But if they hear the stories of someone who is relatable to them, they can no longer feel alone. And so that's what we're trying to do, is empowering people with education, allowing them to connect with one another, to build community from healing, to start to feel a part of this collective again, and not to feel so alone. And practically that is education. It's training healthcare workers, teachers, people in the corporate setting, but it's also making sure we create this library of content, of stories. And so I want to thank, all of the members of the Minds Foundation team who you saw in that video, some of them who are really doing the work. They're going out into these communities and doing this work. And if there's ever a time that we have to realize that mental health is important, it's right now with the pandemic, in which it's affecting all of us and it has no boundaries, whether you're rich, poor, you're in California or India or Chile, it's affecting all of us. And so I don't really know, Manoj, if there are any bystanders anymore, because we all have mental health. We're just on a different part of the spectrum at any given time. So thank you for having me, and I'm looking forward to a further discussion.
That is very true. We do all have mental health, just like how we all have physical health, and being aware of what it is we are bringing to the table is very important. So for our town hall today, the overarching topic is issues and challenges in bridging the gap in mental health care. And one of those gaps, where we've addressed it a couple of them before: information, recognizing your place, your role, but then also, what does mental health look like? So we're going to revisit the White Swan Foundation video, so that way we can take a look at how different it can look from different people's perspectives. So let's take a look at that.
What do they look like? Ugly face, improper dressed. They're not normal like us. Abnormal activities.
They won't be clean.
They may look like a bit scary.
Do you think you will ever have mental illness? No.
Why?
I'm strong. I have my confidence. Do you think you will ever get any mental illness?
No, Baba. No.
Why?
Why? Because I'm happy. That's why.
losing a lot of weight, and I had trouble being still and relaxing. I had trouble resting basically. So I would, no matter what I did, I always felt like there was so much more to do. I couldn't sleep for those reasons. Okay. But it's not like I was getting work done either, right? So I was just worrying about work, unable to sleep, but not able to really make progress with work.
That's probably one of the biggest challenges I've had to face, as in that stark feeling of loneliness where it just felt like there's nobody that you can count on who's within reach. And that became a little scary in between. And but yeah, I think having had it addressed, it's really reset me in my rhythms.
I went through a really bad phase of anxiety. My blood pressure would just drop, just like that without any good reason. I wasn't able to eat. I'd sit down at the dining table with the rest of the family, and I'd probably not even have like 2 spoonfuls, but I would have to excuse myself and go and lie down. I couldn't sleep well. It's very hard to explain, but on the outside, if you looked at me, I came across as any sane person. I would go out with friends, I would be in touch with family, I was doing a great job at work, the children loved me. But the thing is, I was really fighting anxiety day in and day out.
That is when the depression went to the peak, and I couldn't handle. One day, I was like coping every day. I'm like, yeah, I can deal with it. One day, I just couldn't get out of bed, and That's it. I didn't even make a call. Usually I'm a particular person who would, follow the rules and regulations and all. But I just didn't feel like calling the HR or my manager and informing that I'm not coming. I just didn't do anything. So that's what, was a kind of a call saying that yes, your mind is not okay, your mental health is not okay, you need help.
In our clinical experience, we find that ignorance leads to a lot of problems. We see people who do not come to the attention of a mental health professional right at the beginning of illness because they did not know that it was a mental health problem.
I do know that the stigma is real, and I do know that a lot of people are very shy, or I would say the better word would be are frightened to talk about this particular aspect because they are afraid it will affect their prospects.
To identify that this is actually a clinical mental illness. It's not just you acting up, or this is not just you not being in control, this is not you just not being strong enough. This is a panic disorder, or this is a depressive disorder or an illness. If you're saying there are about 3,500 psychiatrists in the country, and I'm guessing most of them are in urban areas, and 92% of the population is getting no help at all, then awareness is the first step. We forget about treating the illness. That's like step number 10. Being even aware that there is a problem, this could be an illness that has actually 100% treatment.
We need more people to share their stories. I want people to come up and say, I have depression, and I don't want people to be laughed at. I don't want people to be scorned. We should not have disdain. We should have empathy. So yes, informed professionals, informed people, informed survivors, informed caregivers is the need of the hour.
All right, so you guys can see why we thought it was so important for us to replay that video and make sure that everybody got all of the content for it. So as we're moving forward now into our panel discussion, we want to remind ourselves of our intention that we set coming into this proceeding, this town hall, about being committed to curiosity. Right. So I'm going to move over to a senior fellow. Can everybody still hear me? Okay. Yes? Okay. All right. So I'm going to share the screen with a senior fellow, Lisa Gunta, to moderate the panel discussion, together with Mr. Manoj and Dr. Garima, who is currently an assistant professor of psychology at the University of Delhi and a practicing counseling psychologist or psychotherapist. She completed her Bachelor of Arts and Master of Arts in Psychology from the University of Delhi and got her PhD in clinical psychology from All India Institute of Medical Sciences in 2014. So joining the panel for the questions today and for their first address. So Lisa, you'd like to take it over?
Yeah, thank you, Dr. V. Am I on the full screen now? Okay, perfect. Yeah, maybe first a few words about myself and my connection also to the mental health topic. I currently work as a design thinking coach and innovation creativity, combining this also more and more with accompanying individuals in their transformation processes. And I also worked for quite a while in a Berlin digital social startup where we built an online platform to give better access to social services in Germany. So this is a little bit my background that I bring now into the discussion. And before we start with the panel discussion, I would also like to share why is the topic of mental health and well-being also so dear to our Melton Fellow hearts. And I feel, especially as Melton Fellows who burn so deeply for changing something in this world, who go for improving ecological topics, who stand for social change and so on. on the one hand, of course, we all work for improving the health of others, the mental health, but at the same time, people who work in the social sector also need to be very aware of their own mental health. I think all of us know this, that when we worry too much about all the problems in the world and put them all on our shoulders, it can be a little bit too much. And we need to be very mindful there with ourselves that we also take care of our mental health. And the Melton Foundation is also supporting the fellows very well in this. So this is also part of the fellowship, that when we work together over several years and programs where we tackle global challenges, that there are specific workshops that help us to get to know ourselves as individuals better, where we learn how to communicate with more empathy, to also bridge the differences between cultures and genders and so on, that all come together in the Melton sphere. So yeah, this is why the topic of mental health and well-being is dear to our hearts on many different levels. And of course, now in the past months, all of us have felt mental health as a much more pressing issue and topic. I'm sure we all had our struggles, and if it was not us who were really suffering, but then maybe somebody in the family or a friend or a colleague. Yeah, so I'm very much looking forward to diving now deeper into a discussion with Manoj and Garima. And I would like to start off with the first question. So which exact challenges do we see right now more strong during this pandemic, and maybe areas or fields in mental health that right now in these months and also in the projected future, because we don't know how much more time the state of the world is going to be like this, that we should really look at more closely? Who wants to start off? Manoj or Garima?
I can start, that's fine. Thank you, Lisa, and thank you, Melton Foundation, for this wonderful platform. I'm really excited to be here and also connecting with everyone. So coming back to your question, Lisa, so I have been a mental health professional for a while, and I'm also an educator. So I work with young people. For the last 5 years, I've been teaching in a Delhi University college. So I knew that the youth have mental health needs, and very, very real needs all the time. But during the pandemic, there was like an upsurge of them reaching out, and they were reaching out not just as people like clients reaching out for help, but also students that I knew, I did not know, and so just to kind of give a bit of a background to what kind of problems were coming up and still are. So either there was a kind of an amplification of symptoms that were already existing. So if there was anxiety, or somebody was a little bit depressive, like I wouldn't say, it's always the diagnosis, but we're all on the spectrum somewhere, that, we have a tendency to be a little anxious, a little depressed. So there was a lot of amplification in those symptoms, and there would be a lot of self harm also, especially with those who are feeling um, unable to regulate their emotions, because there's a sudden change and isolation, especially with the youth, and now being stuck at home, and having a lot of other family issues and conflicts, and dealing with their own mental health issues and needs. So the challenge there was firstly themselves identifying, each one of them, then reaching out, because there's a lot of stigma, especially with the young people. They may have the awareness, like Manoj is absolutely right when he says that the youth today is so much more open and aware, but there are other factors that kind of close in, right? So communicating with the family, what to tell them, how are they going to be accepted by the peer, their relationships, intimate or otherwise, and who do they reach out to? So suppose reaching out to me as a teacher, I also have other boundaries, because when you're a teacher you cannot be a counselor, and then there are only n number of people available who they can reach out to. So there was a sudden need which is continuing, and at the same time a lot of confusion that was adding to the anxiety of who to reach out to. So thankfully there are helplines. There are many helplines that were started. There were many helplines that kind of increased the amount of people that were there to help, but it did not, it's not reaching everyone. And yeah, and I will come to what all we have been trying to do, but this is the need that people have started to realize that they are experiencing mental health symptoms. So they could be pre-existing or they could have come up during this time. So yeah.
Okay, thank you for sharing that.
Thank you, Garima. I think, Garima's covered all the kind of issues and challenges that we see on the ground from a services perspective also. And we have seen that from early April onwards, we have been really offering a lot of knowledge around COVID and mental health to our viewers, thousands of viewers at White Swan Foundation. So what we have seen, and this is something that we, I think, as participants of this panel, this whole event, we must carry home, is that we should be able to detect delays here, delays in making decisions. And Garima is so right, So in our families, in our close social environment, if we are able to see even early signs of distress, forget mental health, even emotional distress, we shouldn't wait. If we don't wait with a fever, why would we have to wait with mental health issue? That's a simple question we must begin to ask, and we must empower everyone that we know. That if you have found somebody with emotional distress, and like Garima pointed out, the early kind of signs would be anxiety. Anxiety across all kinds, because we are all living a very different social life, which we have not been trained to, skilled to handle, and for a long period of time. I was speaking with so many psychiatrists and psychologists. They tell us human being is never trained on handling anxiety for such a long time. We all know. So if a lion comes in front of me, I know what to do. But if the lion is going to stay with me for a long period of time, I don't know. Nobody taught me that. It's very important that we understand that somebody is going through this problem, and the first thing I can do is not to delay decisions here.
Yeah, and what I also observe here in Germany, that this increasing anxiety, it also leads a little bit to people becoming more aggressive and not understanding the other side right now, being in an anxiety, and starts to get pretty tough sometimes in certain discussions. We also have these daily situations when we outside meet and you don't know how is the other side towards, do you wear a mask, do you hug or no? So there's a lot of, suddenly we have to negotiate so much with each other. And those who learned this before, yes, they are in advantage, but others who didn't, there are often big clashes, right? So we already talked a little bit about obstacles that we can see right now for people to get access to mental health care and support. Do you see any other obstacles that we didn't mention yet? You were talking, Manoj, about not being able to take the right decisions. That's a big obstacle. Garima, you were also talking about not knowing where to go, where to find the professional help. Is there anything we didn't cover yet as a big obstacle that we should have in mind that needs to be overcome?
So one of the things, that comes up a lot when we talk to young people and even anybody for that matter from any age group is a lot of doubt around the fact that what they're experiencing, how valid are their feelings, how real are they, because as a culture also our culture romanticizes the concept of suffering to an extent, or you should have that kind of ability to take on things, and oh, this isn't that big, or like trivializing certain things, like parents in conversations might end up saying things to their kids that oh, we were able to manage so much, and what's happened to your generation. So I'm sure it's something that happens everywhere, but I'm just talking more in terms of certain lived realities of people in our culture. And also then there are more instances of internalizing of certain emotions, and they kind of take different manifestations. So a lot of the times that self doubt that do I really need help, is there something wrong with me, how about why isn't the other person is able to do it and why not me? So again, it links to what we were watching in the White Swan Foundation video, that awareness is really the key. Like, we really need to talk more and more about, there is nothing like too much or too little distress. Distress is distress, it's subjective, it's real, and it's valid. And like Manoj says, that nobody is going to say only when you have this much fever are you entitled to go to someone or talk to someone, right? So I think also having conversations, so I see that also as an obstacle, that people themselves are not able to identify whether this is the right time and when is the right time and stuff like that. So
Lisa, can I just, sorry, I just
Go ahead,
wanted to add,
go ahead, Raghu. Yeah.
I think, Garima, this really brings up this idea of this toxic positivity outlook, which I think I see a lot of questions coming up about it. So I just want to address it because it's something I'm passionate about. And I think, what's important to remember, as everyone is jumping on this mental health bandwagon and it's getting a lot of attention on social media and it's all about being positive. The one thing we need to remember is that the perfection of actually being human comes from our ability to have a range of emotions, not just positive emotions or depression, but to actually have this ability to express the joy, to be healthy and to release tears, right? And to actually feel the fear when the lion is there, and then to share that empathy and that compassion. And so it's something very important to remember, that it's okay to cry. It's okay to ask for help, because when you start to suppress that, it's going to actually make you go from mental wellness and well-being and mental health to mental ill health. And so that's where there's a huge barrier. And if we can shift the conversation, which all three of our organizations are working to do clearly, that's the biggest gap that we can try to tackle. So the answer to tackling the gap is actually quite simple. It's using the power of our language and acceptance of each other's emotions.
Yeah, totally. And I also absolutely vow for including in the education system actually already something where we learn about our emotions. Yeah, super many people, myself included, and many of my friends, later on we had to sit down and study emotions and learn which sensation in our body means which emotion. Yeah, and how beautiful would that be if already in our education systems this would be a normal topic. Yeah.
Lisa,
thank you for yeah.
Sorry, Lisa, if I could just add to what Raghu and Garima pointed out, because one of the things we also want the participants to take home is that we are not diluting the importance of services here. What we are pointing out is the most fundamental need here to change mental health. But at the end, we are also saying that we must also create demand for services. Even that does not exist today. Because for somebody to say that, I think I need a psychologist, I think I need a psychiatrist, is a powerful statement. If hundreds of thousands of people with mental health issue begin to make the statement, you will begin to see transformation in the services sector also. And we have seen that in a simple, at least in India, we have seen a huge shift in online counseling in the last 2 years because demand began to happen actually. And this is really very positive aspect, because people started saying that I want online counseling. A lot of counselors began bringing up skills and provide services on the online platform. So we also must therefore begin to demand services, quality services, and affordable services.
Yeah. Yeah, I mean, we're moving now already in how can we overcome these obstacles, right? And it's also good to have more time to speak about this, actually, to also inspire and to really spread the word. What can each of us individuals out there do today, tomorrow, to improve the situation out there? So yeah, do you have any hands-on tips or ideas what the normal person could change in their interactions with peers and colleagues and so on?
Okay, so Lisa, just like, a couple of things, since I've been working with students on campus also. So one of the things is to have some peer supporters, that has really helped a lot. So which means that what we do is the final year students, the undergrad students, we train a few of them and they become mentors or peer supporters to a larger group. And of course, they're in close supervision because it's not possible. Still, universities here do not have a counseling center and counselors. So, we try and do things like those. And the other, of course, is to open up conversation and dialogue as much as possible in these spaces also. Like I remember in one of my supervision group with a supervising therapist, she told us that if you are in therapy, and each one of us, like I'm also in therapy and I'm a therapist, she said that, how comfortable are you telling your client that you are in therapy or telling other people? Because what is not okay for you, you cannot expect it to be okay for the other. So I think, openly talking about things, and this is something I started doing. Like I had a very bad bout of postpartum depression, and one of the first things that I heard from people closest to me were things like, you're a psychologist, and how come you are feeling like that? So this is exactly how the expectation is. It's nobody's going to say that to an oncologist or any other doctor, that how come you have that so mental health, I think one of the things is to talk about it. Second is to create as many community outreach sort of programs. We also use a lot of film analysis and discussions about films and characters, and a lot of art. So I think those everyday life simple things really help, and having as many conversations help. So these are some of the things that I could think of. And yes, another thing to make mental health more accessible, and a lot of psychologists are doing that now, which is to have sliding scales and have provisions of, incorporating certain rebate is not the right word, but having provisions where you can take on people who are coming from certain underprivileged backgrounds, and everyone's doing that now. So it's not only something that you're doing for people who are able to pay, and you may still be a private practitioner, but kind of extending your horizon and letting more and more people come in and collaborating with other NGOs and other organizations as much as possible also helps. So I think Manoj would also have some important stuff to say here.
No, I think Garima, you have covered it, and just to put it simply from our side, we always say that for us to bring in a change in mental health care, we have to create a world where everyone is a mental health ally. And when we go to schools and colleges and workplaces and talk about mental health, this is the single most important message that we carry. Because in a classroom or a conference or an event where 100 people are sitting, we may probably have 20, 30, 40 people with a history, past history or lived experiences of mental health. But why are the rest of those 50, 60 people sitting there? We question that. And then they tell us that we just want to learn about mental health. And then we begin to tell them that how your role becomes the most important one. And so as a mental health ally, the first step you could take is to say that I think I'm powerful and I have a role to play. Can I pick up the right information and knowledge on mental health care? Bring in a mindset shift within me, like Garima said. Can I first bring in a shift in the way I've looked at mental health? And then I know what are the steps that I could take should I find somebody in front of me with a possible case of mental health issue. Demonstrating empathy, making sure that I'm removing stigma, because it's not required that you have to do something for the person with mental health issue. You may do something with somebody else for the person with mental health issue. We bring this up in workplaces. When we speak with co-workers, we tell them that in a cubicle of 5 people, should there be a scenario where one person has mental health issue, if a person wants to be an ally among the 4, then that person can begin by changing the mindset of the rest of the 3 people. And so championing the cause of mental health care can be a big first step that mental health allies could take.
Yeah, Lisa, and just something really quick and practical to do is to change. When we ask someone how they're doing, instead of waiting, someone will say, I'm fine, I'm good, don't respond, right? So just time yourself and give it a minute to 2 minutes where you actually don't respond, you're just present. And there's a 100% chance the person will continue to talk. And so that active listening, and this is a theory of Carl Rogers, one of the psychologists, that can really shift, especially these days when we're so tuned to our phones and social media. So I encourage people to do that one simple thing, and that's something that we can all do starting right now.
Yeah, beautiful. Yeah, create a non-judgmental space where we offer people to really open up and say what's going on, and then also really fully be present and listen. Mm-hmm.
So we have a lot of knowledge on exactly these steps on White Swan portal, Lisa. You will be able to get all the information about how you handle the situations, what you could do, and how could you could be an ally there.
Great. Yeah, I want to also share one insight that we got from when I worked in this digital social startup. We, for a long time, had the idea that people who are in need, they might Google for themselves and look for help, and then in user research we found out no, they will not. At maximum, it's the vendors, as you call them, who are reaching out, but still the tech way, the digital solutions, they are great to have, but still I believe the most powerful is really the direct human interaction. And so I also think all the great projects that we have right now, also like the mental health talks that we just heard speaking, it's so good to have these resources, but also we as bystanders need to use this and also forward this and spread this in our friend circle and so on, and kind of continuously educating each other on this, although we don't feel maybe there is right now somebody in need, but then this can have ripple effects. Okay, so we talked about what could we as individuals do. Do you want to share also a few more thoughts on what in the professional field professionals should focus more on to really bridging the gaps?
Who are you referring to as professionals, in corporate professionals or professionals in the health field?
I mean, people working in the mental health sector. So I know we also have many psychology students here in the call listening. So now getting prepared for their future career. Is there anything you can give them maybe on their way that they should kind of focus on to have as much impact as possible with the beautiful work that they want to do?
I'd love to address that. I'm actually training in psychiatry now after my MD, and one thing that Minds is really focused on is that oftentimes many clinicians in the mental health field, we tend to sit in the clinic, and it's a lot of reactive care, not preventative or proactive care. And I'm going to generalize, but many clinicians, especially doctors, are quite bad at communicating to the general public. And what's really important is that, and this is something we do at Minds, or during our events and programs, you have lived experience stories, but it's often moderated or in partnership with a clinician who can then do the mental health or the psychoeducation simultaneously. I think what I encourage folks to do as they study this field and they get into it to be psychologists or therapists or psychiatrists is to, as you're learning all this material, to think about how you can also teach it to others who are not in the field, and to use your voice to do that. And just really quickly, I know Pragya is on this call, who runs our Mumbai programming primarily for Minds, and she's actually a clinical psychologist who I know many folks on the call probably know, and has done a lot of work, I would say even since before her education in space, to make sure that she's communicating the information. So, I mean, just for a minute or two, if she wants to share any of her experience in doing that, or any words of wisdom for those training, I'd love that too.
Barely any words of wisdom. I think you all have just been great. But hi, everyone. Been a bit silent, but I'll quickly take a minute or two to just maybe address the question that Lisa's just put forth. I think as a young mental health professional myself, one thing that I really keep myself open to, and I encourage in my colleagues as well, is to keep ourselves open-minded, keep ourselves flexible from learning from one another, because I think one thing that I truly believe in is that stigma around mental health is something that may not really disappear even from 50, 60, or I don't know how many ever years ahead as well, because stigma is something that keeps disappearing and reappearing in new forms, new ways, as we keep addressing mental health in relevance and in context to the present times. One of the things that I think I have been actively working on, not just with my colleagues and my team at the Minds Foundation, but also as an individual, wherever possible, where I think Dr. Garima raised the point of romanticization of mental illnesses. And I think as professionals, it's very important for us to put this and bring this point forth that though we've achieved the awareness and advocacy to a much better level as compared to maybe the previous decade, we're now facing and we're now also battling a new fight of romanticization of mental illnesses. And I think we need to sort of also occupy the space anywhere and everywhere, not just that of, mental health context, but general day-to-day conversations also, to be able to beat this kind of romanticization, because it does build a lot of stigma for other people who have been struggling with their mental health problems as well. So this would be one aspect of how I would say that what we need to keep in mind as professionals. And the other thing that I would extremely, I think importantly focus on is that slightly deviant from the topic, but I think we also need to normalize talking about mental health as mental health professionals as well, because burnout also hits us. Self-care is also a part of our well-being, and we also need to take care of ourselves before we take care of other people. So I think there is a need, I think, highly, because it's quite alarming that statistics say that the highest number of suicides among working professionals is that amongst the mental health professionals. That's quite an irony that we need to, I think, fight against together as a community. So I think that's where I will stop.
Thank you.
Thank you very much, Pragya. That's awesome. I actually wanted to add something there, because I think Pragya, you just hit the nail on the head there, because so I don't work in a clinic. I use a private practice. I don't work in a clinic, and I also don't work in a university or school. And I work primarily virtual, and I do a lot of mentorship for young mental health providers that are coming through the ranks and learning. And they always ask that question, and I think who cares for the carers is a huge element to really consider. Like, who cares for you when you are sort of in this stage of not only burnout, but compassion fatigue. Because you're taking on the energy, you're taking on the strife, you're taking on the challenges of every person that sits in front of you. So how do you balance your own energies where that is concerned? But then also, okay, who are you talking to? So I think Dr. Garima spoke about that as well, is that we have to normalize the idea of mental health providers seeking mental health, right? So that help-seeking behavior is not only something that we should preach, but something that we should practice.
Yeah, I think you're raising a very important point here, that also this work where we work with humans, with people, yeah, it can be energetically much more draining than something else where we are not in human contact, especially if we deal with a lot of negativity or difficult emotions that we maybe buffer. So in my colleagues and friends circle, where there are many people who also work with humans, we have a little bit this rule, I don't know, every fourth session that you had with someone, you need to give yourself a treat, you need to give yourself a massage or something where you can kind of cleanse your system and get back into your energy. Yeah.
I always say dance breaks.
Oh yeah, dance breaks, also great.
So Lisa, if I may add quickly one more point, I think Raghu, Pragya, and Dr. We have covered the most important points here. But there's one more angle to this. I'm not a professional, mental health professional myself. I don't practice, but we get a huge opportunity to talk to not just mental health professionals, but even medical professionals in other fields. And that's an interesting exercise because, when we are sick, when we have other physiological problems, we are at increased risk of getting mental health issues. And unfortunately, most of the times, medical professionals are not trained to include mental health care in the screening process. And since we have a lot of existing and future mental health professionals in the participant group here, I think there is a huge opportunity for them to collaborate, work with other medical professionals also across fields. Like Garima pointed out about postpartum area. I mean, we have been working in this area, and we understand how much mental health professionals can work with obstetricians in handling this problem and solving this problem. Be it child care or oncology related problems and everything. So there's a huge opportunity for mental health professionals to work and partner with these professions also.
Mm-hmm. Yeah.
Awesome. So we are going to press pause here for a second and get a couple words from the Melton Foundation. But then also I wanted to check in with everybody on how we're doing. Remember, we started off this process with setting an intention, being committed to curiosity. We came into the panel discussions with the same intention. If you had other intentions too, then great. That's awesome. So that we just remind yourself of why you're here and what you would like to learn. We have some exciting elements still to come. So don't shut off the brain just yet. We know the zoomed out life is real. We know that the online fatigue is real, but let's just blink a couple times to get that juices flowing back to the eyeballs, and then we can move into our second section.
Before you start watching the video, I do have a couple of words that were shared to me by the White Swan Foundation, just something to listen to, I think, before we watch this really powerful video. And it goes something like this. Ever wondered what depression feels like? In this video, a young woman describes her depression as a cloud over her head. Does this cloud really go away? In her own words, she says, I've had a cloud over my head, and I don't really know when it started forming over me. I knew how the textbooks define depression, but I couldn't really define my own cloud and make sense of it until a mental health ally nudged me towards help. This is the story of how I defined my cloud.
I have had a cloud over my head for a long time. For some people, it may start with a triggering event like a death. For some, it might have always been there as a part of them. And for me, I never really realized when it started forming over me. My textbook said that depression had the following symptoms. Cheer up! Okay. People tried to cheer me up but gave up eventually. They thought that pessimism is a part of my personality. I didn't feel like drawing or writing anymore. I thought that maybe my interests are changing. Maybe I'm just lazy and bored. Eat more beta, have vitamins to improve stamina. People saw my lethargy and weight loss as weakness of health. They thought that I was being dramatic and attention-seeking when I self-harmed. Simply knowing the symptoms of depression helped in recognizing it, because I ended up needing a bit more help with that. Since mental illnesses are often invisible, I never heard someone tell their story of being depressed and be able to say, "Oh, that's me." Even to recognize it through someone else's experience would have been so hard. Everyone's depression manifests in different ways. It's like having custom-made shoes. There was something similar about all of us having depression, but everyone's was their own story, their own cloud. I needed all these diverse stories, but the world gave me none. It slowly started taking over my life. I began thinking that maybe this wasn't meant to be this way. Maybe this wasn't meant to be this bad, and that something was wrong. I didn't get out of bed, I slept too much, I lost weight. It got bad. And for the first time, someone noticed. Someone who knew and recognized the signs. For once, someone said something that helped. Let's call that person mental health ally. Instead of saying, "Have some vitamins, let's cheer you up with a fun movie," she said, "Maybe you can try getting help. I know someone, a therapist." I thought that maybe this is a problem. Maybe there is a reason that is not entirely my fault. I almost, for the first time, recognized my depression. There is nothing wrong in your life. How can you be depressed? Others have it worse. People just pretend to be depressed because they don't want to deal with their problems. She doesn't even look like she has depression. Would having depression mean my cloud would be there my entire life? Would it take over my life? I have no reason to be depressed. Maybe it's nothing real. I just want an excuse to not be productive. It's really not that serious. I should just deal with it myself. Maybe it's nothing real. I refused to go get help, but mental health ally still insisted. She gave a simple example. If you don't even get checked, let alone treat the problem, how can you be expected to get better? No one walks into a clinic knowing that they have an illness. "Doctor, I am sure I have malaria. Treat me." When symptoms arise, you get checked. Why should it not be the same with mental illnesses? Mental health ally accompanied me to a mental health expert and I begrudgingly went. It was only when I was assured by her that depression is something people can recover from or manage or live a normal life that I started accepting it. I had a naming the monster ceremony. I looked up at the cloud and called it by what it was: depression. It took a lot of time to stop fearing my cloud and start managing it instead. It took a lot of talking, experimenting with medication, finding the right cocktail of pills, searching in my past and in my present for issues that needed to be addressed. A lot of friends and family listening to me, helping me out. Slowly, I started being able to manage my cloud and it started reducing in size. Recovery is not perfect, but it can happen. It just takes a lot to take that first step to get help. But we just need to make the world an easier place to ask for help in. And there are many ways of doing that, like taking mental health seriously, like not stereotyping mental illnesses as scary, terrible things, like not trivializing them either. By being the small push that some people like me need to go get help, by making spaces that give people help, by telling our stories so that we see we are not alone and that there is always help and hope.
Awesome. Thank you. Thank you everyone for watching, and thank you so much, White Swan Foundation, for sharing this with us. Over to you, Vernice, for the Q&A.
All right, awesome. So to get us started, because that video was pretty much about being an ally, right? And what a mental health ally is. So just to get us a little bit more interactive, I'd love to hear a little bit more from the people who are in the group. At the bottom of your screen, if you're on a PC, there's a reaction button, and you can have either claps or you can give thumbs up. In the chat pod, there's also yes, no buttons that you can use. So I have a question for everyone. do you think that you can be a mental health ally? With the information that you've received today or the information that you have as a part of just living through your own mental issues and challenges, do you feel like you can be a mental health ally? So give me a thumbs up or a clap, a yes or a no.
I think it's a good time for all of us to also unmute and, give a little bit of...
Oh, yeah, sure. That's awesome. Yeah. If you want to just shout me out, you can do that as well. I've got 3 yeses so far. I've got a couple claps.
Yes.
Yes,
No.
yes. Okay, we 5 yeses. Oh, we've got some thumbs ups. All right, so we have quite a few people that do feel like they can be mental health allies. So that is awesome. One thing I'd like our panelists to think about, just in the back of our mind, so we're going to go ahead with some of the Q&A questions, but in the back of the mind, I'll let everybody know what's coming. I'd like Mr. Manoj, Lisa, Raghu, Dr. Karima, everybody that's on the chat to think about things that you should not say to somebody that is going through a mental health issue, challenge. So we spend a lot of time, okay, this is what you do, this is what you do, this is what you do. But what about what you should not do? So think about that for a second. Let that marinate in the back of your mind, and then we will address some of those that would most likely come up as being an ally. What are the things we want to try to avoid? Okay, so for our first question, I'm going to put this over to, let's see, who should go first? Actually, Raghu, if you don't mind answering this question, is it okay to feel like you have no aim and direction in life right now, but you do want to try out a lot of things? So I'm asking you this question because I know that with the Minds Foundation, you have so many platforms and so much reach. You've had some experience talking about mindfulness, so like, sort of being focused and in the moment, but then also toxic positivity. So what do you think? Is it okay to feel like you have no aim and direction in life right now, but you do want to try out a lot of things? What do you think?
That's quite the question.
So we can get personal opinion and professional opinion. I'll let you off the hook.
Sure. Okay, so I think that, you did my introduction, but there's a lot of things that I've done that sometimes it feels a bit disjointed in my own personal life. And I've spent many years trying to figure out what I'm doing and what the path is and what it all comes down to. And I think that you might feel that you don't have an aim or what you're going towards, but deep down inside, there's a reason why we do what we do. And every experience that we have in our life, it's not a positive experience or negative experience. It's an experience that we take with us on the journey. And so for me, what it's come down to when I feel so disjointed is to come back to recenter and think about this thing that I'm doing. Am I getting meaning from it? And does it connect back to my vision that I have and the purpose that I have? And for me, my purpose, fortunate enough to find it, is to create this world where anyone, anywhere has access to mental health, and that we can resurface those feelings of empathy that we're all born with, that oftentimes for many are suppressed through traumas and obstacles, but we all have it. And so if I come back to that idea of, if I do this one activity or this one project, will I get meaning from it, right? And this is a basic concept from Viktor Frankl. If anyone is interested in reading more, to check out Man's Search for Meaning, beautiful, most influential book in my life. So to think about, be open and explore, as Pragya had mentioned earlier, to make sure that we are open and non-judgmental, but to also check in with yourself before you pursue something to see, is this something that I'm deriving meaning from, or is this something that's going to have a negative effect on me emotionally? I don't know if this is answering your question, but that's.
Yeah, I think so. So you're saying that it's important to center yourself, right? So yes, you want to do a lot of things, but at the same time, you sort of feel torn in the direction of not doing anything. So be intentional, right? And spin it on yourself, be more self-aware about what it is that you're actually getting from the things that you actually do. Yes?
Yeah, and the word I'm gonna butcher the pronunciation, but I try to think about drishti, which is alignment or focus, right? And we oftentimes we've lost that, especially during the pandemic. Many have lost that, and there's this push of, oh, this is COVID-19 pandemic. You're at home. You have all this time. You should be doing all these things and being productive and learning all these new things. But no, actually, a lot of people can use this time to tune in with their own emotions and selves who they've run away from for decades. And that's a very powerful outlet. And so just check in with yourself. And yeah, you know, we all are here for a purpose, but sometimes it takes time to figure out what that is.
To figure it out, yes. So Lisa, so we just mentioned the drishti, and that is usually something in yoga science and yoga therapy that is external to you to maintain balance. What do you think of having an internal drishti?
An internal balance?
Yes, that point of balance.
Mm-hmm. What I think of having that, or how to have that?
However you like.
Okay. Yeah, I think for me to come into feeling centered and feeling balanced, it's a lot of letting go the outside, freeing myself of what my parents wanted from me and of what society might expect from me, and yeah, really trying to come to this point that you just described. Of course, not everybody has gotten there, but it's also a lot about centering ourselves in the moment and through the connection with our bodies, with breathing, with feeling tension in certain parts of the body, then feeling what are emotions that I'm carrying right now, and what do they maybe tell me about exactly this experience that I'm having right now in this moment. And then accepting that this is my experience of the moment. So this is what I would call balance in inner balance.
I like it. Okay, so Mr. Manoj, we had a question from Aruna Raman that asked, what kinds of questions do you ask to make the decision to seek the right type of care? So we talked about, okay, you know, physical idea of physical health is taken at a higher priority to mental health. So people are quicker to go seek physical help. But what kind of questions should you ask in order to make the decision about seeking mental health care? And Aruna, if you're in the chat, let me know if I'm translating your question correctly.
So is it, Dr. V, as a person with a mental health problem, or
Yes, so if you're sitting at home, you feel tired, you feel lethargic,
yes,
you lack of focus, all of these things, but you say, you know, I could just take a vitamin, right? Or I just need some more sunshine, or, you know, something like that. What questions you feel like you should ask yourself to weed out, you know?
So, and Raghu will certainly add to this, because we have learned from mental health professionals, Dr. V, that the very simple kind of test you could run. So I think before we get there, I think one of the analogy that we should probably use in understanding mental health or mental health issues is disability, actually. I mean, you know, if you, let's say if I get up in the morning and I have fever, then I tell my boss that I don't want to come today, I don't want to be in office, which means I'm feeling a little disabled in some way, in a temporary way, not to be able to be productive for that day. Similarly, mental health issues will also create some amount of disability in us. So if we find, and this is what we learn from mental health professionals, that if there are indications that some emotional changes are happening in me, which is not allowing me to lead a life which I normally was doing, and there are some kind of disability that is setting in for a prolonged period of time. Because there are chances, I mean, so if I'm going through, let's say, an emotion of grief, there is a chance that for a week I may not be able to go to office, I may not be able to function in a normal way. But then there is resilience built within me as an individual. And that doesn't mean that I have mental health issue or emotional distress. But if that situation, that emotion continues for a longer time, which does not allow me to come out of the current situation and lead a normal life, be productive, then it is a clear indication that I must seek help. Having said that, one of the things we also do in physiological problems is that we say, let me check this out. Let me go to the doctor and find out if there is a problem in me. There's no harm in similar way checking out with any counselor or doctor or psychologist to say, do you think I have some issue? I mean, if it's good, it's really better, because psychiatrists and psychologists again tell us the earlier you are able to go to a mental health professional with your problem, the better the chances of your recovery is. So it's much better for us to make sure that we have reached out without even delaying any further direction.
Manoj, I love that. And, I definitely want Pragya to chime in on this, because this is something that she's spoken a lot with me on. But before I do that, the one thing and concept I want people to think about is mental hygiene as well. So we think about hygiene, we brush our teeth, we wash our hands a lot now, but we need to think about mental hygiene. So the same way we think about physical fitness or brushing our teeth, what is it that we do every day for our own minds and our bodies, right? Is it a meditation? Is it a yoga? Is it a engaging with a therapist on a regular basis and building that relationship? Because oftentimes therapy is not just for when you're in crisis, but it's a relationship that grows with that person to help you grow. And that's a lot of the language that needs to change around mental health and therapy, is that you don't have to just go when you're in a crisis, right? It's to help you grow. And so that's something that if we start to think about mental hygiene as a daily activity and they incorporate it into our life, then we can change a lot of this. But again, as Manoj mentioned, the crisis really comes when it impacts our daily lives and functionality and social, occupational functioning, and so forth. But Pragya, I know you might have some points you might want to add on this too.
I think to Manoj and you, I'd just add this, that would sincerely urge to help people, peers, friends, family, discourage using Google therapy, because I think we all as mental health professionals sitting here, we all get people who like walk in our clinics with a lot of panic and anxiety that, it is this, it is that. And sometimes I think we don't need to really sit and figure out a diagnosis, but we need to simply address problems that could be causing concern and distress. And oftentimes, I think Googling our problems, oftentimes really desperately looking for a diagnosis, really shifts our focus from a lot of things that could really need more attention. So, and I think this is something that we also see in our day-to-day practice as psychologists, as psychiatrists, that not everybody who walks in our clinic necessarily falls under a particular mental health disorder. It could be an adjustment problem, it could be emotional distress, it could be emotional exhaustion. And we don't really need to wait and meet a DSM or an ICD criteria to start, any sort of treatment or management for that matter. But I think in sync with what Manoj and Raghu said, I would just add on to say this, that I think let's just get more real. Let's just get more talking about what our problems are. Something that I think the youth are doing in a very, very big way is that they've got in touch with professionals, talking about their problems, just talking about their negative childhood experiences, talking about how they've not been able to cope as well. Simple things that we all need to make our quality of lives better. So if you realize that the quality of your life is dipping, you don't need to necessarily wait to be able to meet a certain label, because I think, like Dr. Garima also mentioned way before, that we all sort of fall on the spectrum, something that also Raghu was talking about, that we're as human in our experiences and we all fall on the spectrum. So I think, yes, just sort of, I think being in touch with us, being in sync with us. And if we need to sort of get in, a simple check that, okay, is everything okay for me or no? This also reminds me that when I was a student, I had a professor, my favorite professor, who would always say that, everyone walks in for a general mental health checkup. A general medical health checkup. But I think we need something like that in the mental health field also, so that we can simply work on preventive mental health care and well-being, rather than only focusing on intervention-based care for mental health. So I think that's all I would add from my end.
Okay, awesome. So to round out that same point of recognizing that we should be able to have like check-ins that we can do, there are places that you can do a mental health first aid course or psychological first aid or a mental hygiene or sustainability first aid to give you the basic steps to look at on that same route, because we don't really want people self-diagnosing, right? We don't want Google doctors. However,
it was really engaging. I learned a lot today. It was very good, and thank you to all these amazing specialists that have been part here of this panel, because you can feel the passion also you have for this topic. It's not just the knowledge that you were able to transmit through this video, but also the passion. That's very rare, and that's what I really want to thank you also very much about. So a big thank also to Ashi, who has put all this together. Amazing job. Thank you so much, Ashita. Really, really great. And I hope we'll find some sanity in this world. It's tough times, but I used to close every email in the past saying like, I hope you're good and sane. Stay safe and sane. That's what I wrote. And so that's what I also want to close here with. Please, everybody, stay safe and sane.